Hello and welcome. My name is Jody Scholes. I'm your instructor for the MBLEx review course, the Massage and Bodywork Licensing Review. This class takes part in 3 sections. This very first section is a little bit of an intro. It is test-taking strategies. This class. Then we're going to learn. Yes, so we're going to go back and review client assessment. Client assessment is anywhere from 13 to 15 questions on your MBLEx, and unfortunately, they are traditionally long questions. If you've already taken the MBLEx and had the experience of failing forward, meaning that you weren't successful in your first, second, third, fifth attempt at taking the MBLEx, then you will remember that the client assessment questions can sometimes be long questions on your exam. So we're going to learn about client assessment today, and in the third part of class, we're going to dissect some questions. All right. So welcome everybody who's here. Take a peek. Got a full house today. Hello to everyone. And want to talk to you today about what happens on the day you take the exam. Now, many of you have already taken the exam, and you've had an experience that was not successful. Now, one of the things we get to process when we have an experience that is what I call failing forward, that is, we have a feeling. And it's good to feel those feelings. For me, when I am unsuccessful, I tend to be very hard on myself. I don't know if you feel that way too. But sometimes I'm very hard on myself, and there can be some shame. There can be a feeling of shame. Like, I didn't prepare enough. I thought I had this. I told all my friends. I told my family. And now I have to tell them I was not successful. Well, you know what? Having the experience of failing forward is a moment where you get to step up, Buttercup. Yeah. I want you to feel all those feelings. I want you to feel the disappointment, the frustration, all of those feelings. What I want you to avoid is being hard on yourself, because there's no reason to beat yourself up. And let me put it in perspective. If your best friend, if a very good friend from massage school took the MBLEx and was not successful, came back to you and said, I didn't pass, what would you say to your friend, a good friend from school? Would you be like, you're an idiot. You're so dumb. You should have prepared more. You should have, would have, could have. You wouldn't say that to a classmate, would you? You wouldn't beat up a friend who just came to you and said, I didn't pass. So how about you treat yourself like you would treat a friend and have compassion? Be encouraging, right? You might say, that's okay. That's okay. Like, you'll get it next time. Or don't worry. Maybe you would even go to divine order. There was more lessons to be learned. You would be uplifting to your friend, right? You would be encouraging to your friend. Yeah. So I would like you to treat yourself like you would a friend. And be encouraging. Be patient. And yeah, feel all the feelings. Absolutely. I'm not saying that to deny any disappointment or frustration. I'm just saying you are an excellent massage therapist. I truly believe that this work is not about you choosing a profession. I think this profession kind of chooses you. Like, you're just good at it. And so with that in mind, There's no way you can fail. Yeah, a test might have said you didn't pass, but that's okay because we've got the next game day. We've got the next fight to fight. We've got the next round. We've got the next chapter. And so we close the door on that chapter and we look towards the next day. So I call it your Super Bowl, your game day, the big fight day. So I don't like to frame it in the terms of a fight, but sometimes we do feel like we got punched a little. But the next game day. And so my message to you today is to control what you can control on game day. So maybe you haven't had the experience of failing forward. There's about 50% of you guys, about 50% of you who actually pass on the first go. Woo-hoo! Yes! And if that's the vision you're holding for yourself, I hold that with you. Yes. And part of the way we are successful, whether it's the first time or the 7th time taking the MBLEx, we control what we can control on game day. Game day is the day you're taking the test. And so we are controlling what we can control. We have dressed comfortably. We've eaten a good breakfast or a good lunch. We've arrived way early. So more than the 30 minutes that is required. It's required that you're there 30 minutes in advance and you are in the building 30 minutes in advance. They're not playing with that. So get there way early. Get there an hour in advance. Sit in your car. Just listen to some positive music. Listen to some positive affirmations. Just be present in the moment. Listen to your breathing. We are controlling what we can control on game day. Because once you get into the game, so if you watch football or if you watch soccer, or once the game starts, once the whistle blows, bang, it is game on. And so we have to stay present before, during, and after our game day. Okay, stay present, listen to your breath. And that really is part of the best practices you can have now while you're taking practice exams, while you're doing classes, while you're here. Tune into your breath. Let's just do that for a moment now. Just tune into your breath. Breathe in through your nose and out through your mouth. We're going to do that 2 more times. Breathe in through your nose and out through your mouth. 1 more time. Breathe in through your nose and out through your mouth. The breath. It's one of the best ways to return to the present. And for us, all is good in the present moment. Let's talk some client assessment, shall we? Welcome back to the MBLEx review. And I want to say thank you to Laura Allen. She's an amazing teacher, an amazing instructor, a wonderful business owner, and she wrote a book called Plain and Simple Guide to, basically it should be called the MBLEx, but some of the questions, some of the content I've pulled from Laura's book. So I just want to give her a shout out. Here's what we'll be covering today. We'll be talking about the organization of your session, the components of your session. These are things you might be asked about on the MBLEx. So client assessment, reassessment, treatment planning. There's some phrases that we'll need to know. So the client consultation, we'll need to know a little bit about the verbal intake, a health history, about the collection of written data. We're going to talk about visual assessment, palpation assessment, postural assessment. We're going to talk about range of motion and how that plays into your assessment. And then we're going to talk about using your clinical reasoning to design an amazing session for your clients. All right. Here's the order of the traditional assessment of a therapeutic massage client? Initial assessment or reassessment? All right. So we're going to talk first about the client interview. That's the review of the health intake form and all of the components that go along with the health intake form. So your client is giving you a health intake form, and what are you going to do with it? You're going to read it. And if you haven't seen this client in a while, or they're coming back after an absence, or even after a week, what are you going to do with that health intake form? So it's their second, third, 10th, 100th visit. What are you going to do with that health intake form? You're going to read it. Yeah, okay. So the initial interview. Then we're going to do a visual assessment. We're going to incorporate an intentional visual assessment into our initial health intake, or into our health intake. And then we might be doing some palpation, right? This is just a logical flow. Let's talk about it. All right. So we're going to, every time, review the health history. Maybe this is the first time you're working with a client, but it's not their first massage. We need that health history form. Every new client fills out a health history form. You'll see why in a minute. Okay. With that health history form, you are going to almost automatically do a visual analysis. So as they're walking into the treatment room, you're kind of looking at their movement. Are they walking with a limp? Are they walking with a different type of gait? Gait is another word for walking. Sometimes we do gait analysis. We watch our client walks. And we're going to potentially do a postural analysis. This is all during that health intake. This is before the client actually gets on the massage table. We might do a postural analysis. We might palpate. We might do some special tests. And if you're trained in it, you might take their vitals. Depends on the environment that you're working in, right? What would it be like to take vital signs? That is not a part of a traditional massage session, but I just want to let you know that there's all sorts of things you can do to get an accurate picture of where that client is right now. Some of it will depend on your environment, on where you're actually seeing the client. Medical office, chiropractic office, home office. But these are all components of a client assessment that you could be asked about on the MBLEx. This is what a health history form looks like. And so you're going to review that written data. Every time. Some of you are using tablets. Maybe you'll be working in an environment where the health history is on a tablet. Pull one thing out of that health history that stands out to you and ask the client about it. We'll talk a little later about building rapport, but one of the best ways to build rapport is to pull something out of their health history and ask them about it. And this is a slide that says, hey, there is gold in them there hills. It's an old saying from a cartoon. But what I mean by there's gold in them there hills is when you ask the client questions, when you ask that client open-ended questions, yes or no questions, you start to understand the client's goals from this session and what the client's goals are and are not from the session. It helps you to meet those expectations and also manage those expectations. All right, so we've talked about the client interview. Let's move into visual assessment and palpation assessment. What does that look like? All right, so the visual assessment, you might even find yourself doing it now outside of the treatment room. Have you ever been like walking down the sidewalk or maybe at the grocery store and someone's walking with a real like funny gait? That is you using your skills of visual assessment to realize to determine, hey, something's up with that walk. Has that happened to you? Yeah, right? I remember the first time I was like in Home Depot or Lowe's, and I was like, ooh, that guy's walking kind of funny. And it's just stuff we pick up on now because when we're seeing clients, we're using our tools, our visual assessment to observe the posture, the movement, body language, all of these things. In your visual assessment, you might take it another degree and do what's called a postural assessment. This is also something you may be asked about on the MBLEx. What is a postural assessment? A proper postural assessment. A proper postural assessment includes a plumb line. So you see this red line going down through the middle of this client? On the bottom here, you see a weight. This is actually a wall chart that you can get for the back of a door or for a wall. And it helps you to see, are the shoulders even? Okay, and from the side here, what else do we see? And postural assessment is so helpful. You won't probably be doing this for every client, but you may be asked about it on the MBLEx. It's one of the tools in our toolbox that we use to support our visual assessment. Take a peek at this. Oops, all right. So all movement, as a reminder, starts from anatomical position. Please remember that, especially in your client assessment questions. With your client assessment questions, they are starting from neutral, which neutral in our case is anatomical position. I'm going to warn you later on in class, we've got a question, and it has to do with what happens when, or what would you see if. But I'd like you to just keep in the back of your mind, all movement starts from anatomical position. All right. And you can see here this figure, hands at the sides, palms facing forward, feet are hip width apart, they're looking anterior. This is the front view. This is anatomical position. Okay, here's a little client assessment quiz, if you will. A little, what do you see? What do you see here? Can you put it in the chat? So if you're listening and not watching, we're seeing a male, a young male, in a white t-shirt. And I'm asking in the chat, what do you see? So what do you see? Oh, wait a minute, we have people in the waiting room. Oh, crap. Yeah, I don't see anyone in the waiting room. All right, but I'm giving you just a minute. We'll edit this out later. What do you see? What do you see? Ooh, Shannon. Shannon goes out on a limb and says, yeah, forward shoulders. That's exactly what you see. See those forward shoulders? See that rolled forward? It's kind of like roll your shoulders forward, right? Roll those shoulders, internal rotation, right? Internal rotation of the shoulders. See how it's a little concave in the chest? You can see it here. See the t-shirt is kind of pulling, it's kind of concave, little rolled forward. Might be from, muscular development, right? But this is an example of visual assessment. You're seeing this and you're like, huh, got some big old traps here, right? We got a little internal rotation. Look what's happening to the thumb here. Compared to anatomical position, see how the thumb is out? What's happening here? Ooh, the thumb is in. Ooh, internal rotation of the shoulders. What might be your treatment protocol? Let's see. Yes, head is a little forward. Yes, left side is higher than the right. Good. Yes, Diana, yes, sway, the sway back. Yes. Oh, here we go. Look at this, all this. All right. So yes, forward deviation of the spine. Yep, that's sway back. Diana, Letitia, yep. Valerie said head is forward, yes. Left side higher than the right, Myra Renee, yes. Lower back inward, right. So that posterior pelvic tilt, right? A little sway back. Excellent, excellent. So what I wanted you to see first and foremost was right here at these shoulders, how you can visually, when you just pause, look, a little forward head position. Let's look at the next person. So you may not have thought about it, but what happens when we've got this internal rotation of the shoulders? Now, this is an advanced client assessment question you may see on the MBLEx. Shoulder internal rotation, right? We've talked about what happens when we go from from the anatomical position where the thumb is out. So in anatomical position, thumb is out, right? Here, the thumb is in because of the internal shoulder rotation. But look what's happening to the scapula. It's actually got a little bit of an anterior tilt. Just wanted to point that out because sometimes you get these advanced client assessment questions that are crazy. But just so you can see it, this is part of what your visual assessment is going to lead to your treatment planning, right? So visual assessment identifies internal shoulder rotation, just like this guy here. And we're like, okay, we better work that chest, right? This guy here. All right, we better work that chest. Something's happening. But likewise, there's going to be something happening at the scapula as well. All right, ready for another one? What you see? Ready, ready, ready? What do you see? You named it in the other one. What do you see? This is a really easy thing to do with a client. And again, the purpose of identifying this postural deviation, it's called a postural deviation. Again, MBLEx terminology, postural deviation. So neutral spine is balanced. A postural deviation is what you see here. And so if your client, when they stand up against the wall, cannot put their head back against the wall or don't put their head back against the wall, this is what's called forward head position. Okay, what do you see? I've given you some green lines. What do you see? Valerie, yes. Good. Head was forward, correct. And on this one, what do you see? Yep, yep, yep. Eversion of the foot, yeah. It's gonna cause eversion of the foot, but what is this called? This compromise of this area. What is this area right in here? What is it called? I'm waiting. I know, I hear you. I hear you saying it. You're not saying it to me, though. Put it in the chat. Okay, so we see this little compromise right here. Yes, yes. Okay, we see a happy back. Okay, I'm glad you see a happy back. Good. So what you're seeing here is a flat foot. You're seeing a compromise of the longitudinal arch. Let me say it again. What you're seeing here yes, very good. So eversion of the foot, yes, my Renee. Yes, Pumla, flat foot, yes. Okay, so what you're seeing here is a compromise of the longitudinal, the long arch, right? The longitudinal arch of the foot. And look what happens. See how it makes that, it's a little bit more of an, here, let's see the next picture. So this is how a flat feet leads to a knock knee. And so you're seeing it here just a little bit, that knee comes in. But in this one, you can see it just a little bit too, how that flat foot leads to a medial rotation, a medial angle at the knee. Again, part of your visual assessment. And I walk you through this because on the MBLEx, you will be asked at times a very long question about the compromise of the longitudinal arch and what's your treatment protocol, what's your treatment plan. And if you talk about the hips or the low back or the shoulders, that's not what we're looking for. What we're looking for is an explanation that this compromise of the arch leads to an internal pressure on that knee. Medial rotation, medial movement. So again, visual assessment leads to things we see. Visual assessment helps us treatment plan. This is part of what you're going to be tested on the MBLEx. This is considered your critical reasoning skills. You're going to take something like this and say, okay, what do I see? It's more like this. They're going to describe to you the flat feet in words. Okay, there's been a compromise. They won't say flat feet, by the way. They will say a compromise or a failing of the longitudinal arch. And so when you hear or read that, you'll be like, okay, where are we? We're in the foot. What is happening there? And so it's going to ask you to use your clinical reasoning to decide on the best treatment protocol. All right. So visual assessment helps to plan your treatments. Visual assessment informs your treatment planning. Let's move along. Okay, so we've talked about the health history. We've talked about the visual assessment. Now let's talk a little bit about palpation. I mentioned in the very first part of class that your health intake can last up to 15 minutes. Wow, 15 minutes. You're not getting paid for that. Well, depends. In my practice, when I have a 60-minute session, it's 60 minutes of table time. That varies from practice to practice. If you decide to work with a franchise, most of the franchises book every hour on the hour, and it is a 50-minute session. We don't have a lot of time for client assessment in a traditional franchise model. So Hand and Stone, Elements, Envy, all of those. Unless you ask for something different. If it is a new client, how are you going to feel comfortable and confident in designing that treatment session? The MBLEx, the Massage and Bodywork Licensing Exam, is expecting you to do a thorough client assessment. Just saying. Let's move on to palpation. I like palpation because it is a way that we build rapport. Let me show you how. So what is palpation? Palpation is touch, right? Touch it. So we're gathering information prior to them being on the massage table. A palpation assessment is normally prior to. Of course, we're going to palpate, once they're on the table, but I'm speaking to before they get on the table, fully clothed. So we are going to touch the client. What are we going to gather? What information are we going to gather from touching the client? You can assess the quality of the soft tissue, but look at this. Why? So why would it be appropriate to include? Well, you know that warm tissue means there's adequate blood flow. Cold tissue, ischemic tissue, remember that word? Ischemic, here it is right here, ischemia, Ischemic tissue means there's a lack of blood supply. So the muscle has gotten tight, it has restricted the blood flow, and therefore it might feel cool to the touch. But more so than the cold or hot, or the warm or the cool of the tissue, think about it in terms of building rapport. When a client says, "Oh, it hurts in my low back," can you show me where? Touch it on yourself. And this again is your own boundaries, but show me. Show me, touch on you. How many times have you had a client call a body part by the wrong name? Oh, my clients will tell me about it all day long about how their quadriceps are tight. And then they point to the back of their leg. You're the expert. You get to figure out and interpret what your client is actually saying. So have them show you, where does it hurt? Right here. Is it only on that one side? No, right here too. Okay. The other option with your palpation assessment is show me on me. Show me on me. And you turn your back and they point. Brrr. If they can't reach it themselves, maybe you're working with an elderly client. Maybe they can't reach up to their bra strap. Show me on me. Where does it hurt? And that way you can thoroughly understand where that pain pattern is for your client. It also builds rapport because it demonstrates a sincere interest in understanding the client's concerns. All right. So that's how to use palpation as an assessment tool in your practice. We may also want to use palpation in our range of motion. Let's take a look at range of motion. There are some special tests with range of motion. And range of motion is basically, is there a normal range of motion? How many of you guys right now have restricted range of motion in some joint in your body? A shoulder, knee, ankle, wrist. I want the client to show me. If they say, "Oh no, my shoulder's jacked up," let's find out how jacked up, the shoulder is. We can do range of motion tests. As this pertains back to the MBLEx, your questions will say they had restricted range of motion with stretching, passive motion, active motion, assisted. Just hold on for a moment. We'll get to each of those definitions in just a moment. I want to show you this one special test. It rarely comes up on the MBLEx, but just in case, so you know. This is called the Thomas test, and it is testing hip flexor tension. Feel free to pause the video if you're listening later and read through this. So in this case, we're asking the client fully clothed. This example happens to be in a pair of shorts, but your client will be fully clothed, laying down on the table, knees draped over the end. Your client may need assistance getting into this position. They may need assistance sitting up from this position. But we are testing tightness of the hip flexors. The Thomas test determines tightness in the hip flexors. In this case, the upper image here, the client is pulling their knee towards them. The opposite leg lays flat on the table. In the second diagram, the client pulls the knee towards them, and the opposite leg rises off the table. If the opposite leg rises off the table, that is a positive indicator for tight hip flexors. This is actually a PT test. We're not going to be asked a lot about physical therapy because it's out of the scope of practice. However, you do need to be aware of these tests, that they exist, and that they exist to test range of motion, and also positive or negative for tightness in particular muscle groups. We're just going over the Thomas test. if you get a question like this, it's advanced. That's the good news. It's a tough question, so you're going to get more points for it. But I just want to let you know these exist, and it helps to determine the treatment planning. In this case, if the client were to test positive for tight hip flexors, we would want to include treatment of the hip flexors in our massage. So, when we test range of motion, normally it's done either standing or on the table. In this case, you see a picture of a person on the table. It's normally done fully clothed for the purposes of maintaining modesty. And there are 3 types of movements here, 3 types of range of motion tests. That is passive, active, and active assisted. These descriptions apply to the client. Let's take a look. So, passive range of motion, that refers to the client. Are they active or passive? It applies to the client. Now, in this image, you'll see the client actually has their hand on the leg, right? And so that is not fully passive. Imagine that hand was not on the leg, it's down by its side or on its chest. The client just puts their hands here on the chest. Passive range of motion means the client is passive. You, the therapist, are doing all the work. So we want to test with passive range of motion to determine any restrictions. But passive refers to the client. They're not doing any work. Compared to active. You say to your client, oh, your shoulder is jacked up. No, excuse me. We wouldn't say that to a client, right? Our client said to us, yeah, my shoulder's jacked up, because we paint positive pictures. We always paint positive pictures for our client. All right, so you've got some restricted range of motion in your shoulder. Go ahead and let's see. Let's raise your shoulder to the side. Raise your arm to the side. Go ahead and you do it at home if it's safe, if you're not driving. Go ahead and raise your arm to the side, just like this picture here. All right, raise it to the side. Now go ahead and raise it overhead, palm forward. Just watch what happens. Watch what happens how your client, this is called active range of motion because your client is active. You are not assisting. Your client is moving. Go ahead and raise your arm. Sometimes your clients will just show you, oh man, I can only raise my arm to here. Oh, and then I get pain. Yeah, oh, then I get pain. Okay, so that is a test, which is active range of motion. Why do you care? Maybe you will never use this in your practice. You may never ask your client to actually to move. However, on the MBLEx, you may get a question that says, your client has pain during active range of motion. Just so you understand what it is. Now, of course, we have passive, we have active, and then we have assisted, right? Active assisted. And that means we're assisting the client. So, oh, I can only raise my arm to here. So, or I can only raise my arm to here. Okay, how about if I assist? Can you go higher? So passive, active, refer to your client. Are they moving? Are they helping? Active assisted means that they're actively moving, but I'm going to assist. All right, just so you're familiar with what these are actually talking about. One other consideration when we're gathering information from our client is to know the difference between signs and symptoms. In your practice, when you're practicing as a massage therapist, doesn't really matter. They're going to tell you what they tell you. For the purposes of the MBLEx, we want to understand signs can be measured. Signs are objective. So they have an elevated heart rate. They have elevated blood pressure. You've done a visual assessment. They have forward head position. These are all signs. Symptoms are subjective. The client feels a certain way. Oh, I'm thirsty all the time. My back itches. I've been feeling exhausted. These are all internal, subjective. Your client is telling you their symptoms. Both signs and symptoms are important in treatment planning. However, one can be measured, signs. It's like you could read a sign. Just stop, yield, go. You could read that sign, right? So you can measure, you can see it. With a symptom, it's coming from inside. We're doing some good review today. All right, let's talk about informed consent. And this is before we get into dissecting our questions, just covering a couple other bases. What is informed consent? If you're tested on the MBLEx, you will want to come from a conservative point of view. You'll hear me say this over and over again. The MBLEx is looking for mostly a conservative point of view. So, informed consent. We've already done the health history. You're saying to me, Jody, they already signed off. I can give them a massage. Yes, you can give them a massage until you get to an area where they may not be expecting massage. What are those areas? So, the areas would be the glutes, the abdomen, the adductors, the groin. This also, informed consent, doesn't cover any modalities you just throw in. Say you've been trained in cupping. Are you trained in hot stones? Do you have hot towels in your practice? We need to let the client know that a different treatment is coming. We can't just slap hot towels on someone. We have to let them know verbally. It may have been in your written health history or your written health intake, but if you decide, oh man, I really need to work on this guy's glutes, we have to let them know it's coming. I like to just use a soft fist and touch the top of the glute and then say, is it okay for me to work in this area? That is verbal informed consent. The client is saying a yes or no. Sure. If you touch that area and all of a sudden they tighten up, have you ever had that happen in a massage? You go to like work an area and that means we now need to verbally check in. Is it okay for me to work in this area? For the purposes again of the MBLEx, we do get our written informed consent, but at times we also need verbal informed consent when we're using a new modality or we're working in an area like the glutes, especially the abs, sometimes the adductors and groin. You're going to have to talk to your clients at times. I know a lot of you are like, oh, Jody, once the massage starts, I don't like to talk. Okay, that's fine. You are a licensed healthcare professional. Now and then you have to ask your client a question. I know it interrupts their happy place. It brings them back. I would rather you ask them for verbal consent to work their glutes than to shock them, surprise them, or make them feel uncomfortable. Right? Yeah. So let's step up our game and know that now and then we are going to have to communicate verbally to the client during their session. I mean, literally yesterday, I had a client who said, Jody, I don't talk during my massage. I said, well, good. I'm still going to ask you questions now and then. Is that okay? If I have a question, is it okay that I ask you a question? Absolutely. It's like, yeah, sure. But the client told me they prefer to stay quiet. I will only ask a question about pressure or about, hey, I'm going to work in this gluteal area. Is that okay? I'm going to work in this area, tap, tap. Is that okay? Building healthy client relationships counts on professional communication, healthy boundaries. We just talked about informed consent, right? If you have a client who has been sexually abused, their unsafe area may be way bigger than the normal person. They may not want any work on the groin, any work on the adductors, any work, don't touch the inside of my knee. They may never tell you about their sexual abuse, but because you respect healthy boundaries, because you use informed consent, they won't need to. You will be able to let them establish healthy boundaries without having to disclose too much. That's a part of your professionalism. And so building that rapport, building that trust, building that clear communication, having draping, strong draping, clear draping, tight draping. And I'm not talking like, like super tight, but draping is part of the way you build healthy boundaries, healthy communication, trust. And that improves your client relationships. And this is about your assessment, your reassessment, and your treatment planning with every client. Let's talk a little bit about local and specific contraindications, and then we'll move into our dissecting the questions. All right. Just understand, sometimes these terms are used with different words. Local contraindication may also be called a specific contraindication. A general contraindication may also be called an absolute contraindication. These words are used interchangeably, and at times both are used on the MBLEx. What is a local contraindication? Local contraindication means avoid the area. And ladies and gents, in your practice, it will depend. However, I want to reiterate, for the purposes of the MBLEx, be conservative. Be conservative. Okay, so local contraindications avoid the area. So contagious skin conditions, such as athlete's foot. Hives, is there any chance you're going to make that any worse? Probably not. Poison ivy, for the purposes of the MBLEx, consider that a general contraindication because it is systemic. I have put it on the list with local because I'm hoping that by the time the client gets to you, it's just they've had it for a long time, it's at the end of the cycle, but depending on the person, we could make it worse. Poison ivy is not contagious. You can't get it from a client, but we could spread it to different areas. So recent surgery is also considered avoid the area as long as it's not major surgery. If it's major surgery, they need to wait until they are healed. That's because they will have an open wound. Varicose veins, of course, avoid the area. Frostbite burns, psoriasis. Let's take just a look at psoriasis and what that looks like. Psoriasis is a skin condition of dry and flaky skin. Sometimes it is in a widespread area. And this is a time where we need to say to the client, look, you've got some psoriasis here, or you've got a skin condition. Is it itchy? Is it uncomfortable? In this case here, with the arms that we see here in the lower right hand, we want to avoid that area. It's not going to improve the condition. So let's just avoid the area. And the client is usually happy to say, yeah, just avoid the area. So psoriasis is not contagious. It is a skin condition. It can benefit from body work just because it'll help the immune system, but we're not going to work directly on the psoriasis, and that is simply because it just doesn't feel good. All right, so those are the areas called local contraindications, uh, examples of which we will avoid the area. So general contraindications mean we could make the condition worse. That means we cannot do the massage without potentially making the situation worse. That would be considered a general contraindication. For example, flu, nausea, uncontrolled high blood pressure, major surgery, high-risk pregnancy, concussion, COVID, and then also chemotherapy. If they're getting chemotherapy, we need to wait 48 hours. These are considered general contraindications because we could make the condition worse, or they're contagious. Ready to dissect some questions? Ooh, how about we take a breath, huh? Take a little sip of water. Okay, we've got quite a few questions. I think we have like 7. Ready? Take a breath. In through the nose, out through the mouth. We're changing gears. What does SOAP stand for? What does SOAP stand for? A, subject, object, assess, plan. B, subject, objective, assessment, protocol. C, subject, objective, analysis, procedure. D, subjective, objective, assessment, plan for future treatment. What does SOAP stand for? Ooh, I see. Is that Frankie? Rico? All right, Shannon, yes. Yolanda, yes. Pumla, yes. Valerie, yes. All right, let's eliminate one wrong answer. It is not subjective objective assessment protocol. Not that one, but you guys got it. For those of you who put answers in the chat, da-da-da. Yes, it is letter D, subjective, objective, assessment. What did I do during the session? It is a reporting of what your treatment was, and then the plan for the future. Good. Oh boy. Let me move us out of the way. All right. Question is, what must a therapist establish with a client in order to build trust and mutual understanding needed for a healthy therapeutic relationship? A, time is the only thing that will establish trust with a client. B, rapport. C, explain the plan of treatment to the client before every treatment. This assures the client won't be surprised by where you work or the modalities you use. D, have your diploma and resume or credentials on your website so clients know you're qualified. All right, let's see. Ooh, we get varying. All right. We're 50-50 here. All right, take a look. What must a therapist establish with a client in order to build trust and mutual understanding needed for a healthy therapeutic relationship? Okay, well, one thing we know, we can eliminate a wrong answer, right? Let's eliminate letter A, because time is not the only thing that will establish trust with a client. So be careful of these words like only or every. Only or every. Be careful of those. We are 50-50. All right, we're seeing B and C 50-50. Remember what I said. Look at where my cursor is. All right, you ready? The best answer is letter B. What must a therapist establish with a client in order to build trust and mutual understanding needed for a healthy therapeutic relationship? B is rapport. And I hear, why isn't it C? We have to explain the plan of treatment. Didn't you just say we should explain the plan of treatment? Yes. However, not before every treatment is that necessary. This is an example of finding the best answer in a question. And even though rapport seems too simple, too short, we need to say more. This letter C is disqualified because explain the plan of treatment to the client before every treatment. If you've been seeing a client once a week for a year, you've established rapport. You may not need to explain the plan of treatment for that day. They may look at you and just say, do what you always do. Do whatever you need to do. Now you'll still do the health history. Any changes? Anything? What are we working on today? What's going on? There'll still be that dialogue about health history and treatment, what the client goals are for treatment. But because you have rapport, you don't necessarily need to explain, I'm going to start you face up, then I'm going to have you go face down, right? Okay. That's why we do this. What is the form of question that requires a more detailed answer than yes or no? I'm just going to let you read this one to yourself, okay? What is the form of a question that requires a more detailed answer than yes or no? Please put it in the chat. Oh, yeah, Valerie, you got it. Shannon, yeah, Pula, All right, well, we know that we can eliminate one wrong answer, right? Let's get rid of B, because true and false is kind of just like yes or no. So we don't want to ask the form of a question that's true or false, because we want a more detailed answer. All right, let's see. Yolanda, yes. Lauren, yes. Exactly. The best answer is letter A, an open-ended question. So how does it feel? Tell me when it first started. An open-ended question allows your client to tell a story, to tell you a little story about their symptom, about their pain, about what their expectations are for the session. Great. So have you ever had a massage before? Yes. Tell me about that session. What did you like? What didn't you like? We want to elicit more information from the client, which will help us plan our session. Your client has an abnormal response to a heat treatment. Where is that documented? A, at the front desk, so the receptionist can inform the therapist if a different therapist works on the client. B, near the hot rocks or where the hot pads are kept, near that heat equipment. C, on a sticky note in their chart. D, in the soap notes of his or her chart. Your client has an abnormal response to a heat treatment. Where will that be documented? Stan is on fire. Valerie's got it. Ooh, oh, Lauren, yep. Puma, yep. Oh, Rico Suave, yep, you got it. Yep. Yes. All right, let's eliminate one wrong answer. We know it's not going to be kept at the front desk, right? Because that's a HIPAA violation. It's confidential information about the client. Yeah, so we can't keep it at the front desk where everyone can see it. No. All right. And so, you guys, you got it. Oh, yep, Yolanda, you got it. Good. The best answer is D, in their soap note chart. Yes, because as a licensed healthcare professional, as a licensed massage therapist, you are reviewing the soap note chart before you begin a session. Now, in your personal practice, you may put a sticky note in there too. The best answer for the MBLEx is where those records are kept confidential, and that is in the soap note chart. Oh boy, range of motion. You ready? Which type of range of motion assessment is not affected by the client's strength? Which type of range of motion assessment is not affected by the client's strength? I'm going to read that one more time because this is a little bit tricky. Which type of range of motion assessment is not affected by the client's strength? We get to active assisted range, active range, passive range. Range of motion isn't affected by the client's strength. All right, got some answers in the chat. Oh, yes, yes, yes. Good, you guys got it. You guys got it. All right. Let's eliminate one wrong answer. Range of motion is affected by the client's strength. So you get to pick A, B, or C. All right. Boom. Yes. Great work, you guys. You picked letter C, passive range of motion, because passive range of motion, the therapist, I'm moving you. If you are my client and I take you through a passive range of motion, doesn't matter how strong or weak you are. I don't care if you're a bodybuilder or you're 75 years old, 85, 95 years old. I'm going to take you through a range of motion. Doesn't matter on your strength. We're just testing range of motion. Very good. Yes, good job, you guys. Excellent. All right, just making sure that we can do what we need to do. All right, next question. Internal rotation. All right, alrighty. You ready? Internal rotation of the upper extremities can result in the dorsal surface of the hands facing which direction during relaxed standing posture? Do you hate this question? This is a great example of an MBLEx question. All right. Internal rotation of the upper extremities can result in the dorsal surface of the hand facing which direction during relaxed standing posture? Let's figure out what the heck they are even asking. Okay. I don't see any answers coming in. Okay. So we start from anatomical position, right? So we're in anatomical position. Let me pull my picture up here so you can see. All right. Anatomical position, right? Get yourself into anatomical position. Ready? Internal rotation of the upper extremities. Internally rotate your upper extremities. Where is the dorsal surface of the hand? When you go into internal rotation of the upper extremities, the dorsal surface of the hand is facing what direction? Okay, let's get rid of one wrong answer. Oop, shit. So posterior. Our dorsal surface, oh, we need to know dorsal surface of the hand. Where's the dorsal surface of the hand? Touch it. Touch it on yourself. I'm not going to show you right now. All right, I'm going to show you to help you get to the right answer. Dorsal surface of the hand. Palmar surface, dorsal surface. Oh, we got answers. All right, we got answers. Yes, back of the hand, that's correct. Okay, I can't even tell. Think about what direction is the thumb facing. When you have internal rotation, I'm going to go into internal rotation of the upper extremities. So internal rotation. What direction is your thumb right now with internal rotation? And where's the top of your hand facing? Yes, a few of you got it. The correct answer? Anterior. What? It's not medial? No, because medial, look at this. Medial would be my palm like facing. Can you see it? So the dorsal surface of my hand is facing anterior. Medial would be my palm facing towards the wall. Now, yeah, that could be extreme internal rotation. But in a relaxed standing posture, we're usually not getting palms facing out, right? You with me? Let's see. Okay. Maybe you're with me, hopefully. All right, got. Oh, we don't. That's a wrap. Yay! Woo, we ended with a big one. Okay. So thank you so much for being here today. I'm going to wrap up the recording by reminding you my name is Jody Scholes. I am your instructor for the MBLEx review course, and I love going through this stuff with you. I'm really happy you're here, and I'm really happy that you're on this journey to be a licensed massage therapist. We need you in the world. We need you. So bid you adieu for now on the recording, and see you again real soon.